Our next panel of media educators and journalists will talk about designing and implementing media literacy interventions and fostering a culture of healthy skepticism in news consumption. The session is titled, What is the Role of Media Literacy in Tackling Health Misinformation? And for this discussion, I'm happy to introduce Helly, who heads Beyond Fake News for BBC. Mari will moderate this session. The speakers for this panel are Ying Chang, the founding director of the Journalism and Media Studies Center at the University of Hong Kong, Melissa Sweet, who's the founding and managing editor of Croakey Health Media, Masato Kakmoto, associate professor at the Journalism and Media Studies Center at the University of Hong Kong, Dilrukshi, who's a lawyer by profession and director of the Center for Investigative Reporting in Sri Lanka, Kanchan Kaur, who's a professor of journalism and the dean at the Indian Institute of Journalism and New Media, and andSurabhi Malik, program director at Internews India. Thank you for joining us today. We look forward to your discussion. I just want to remind the audience that the panel will take questions at the end of the session. So if you have any questions, please just type them into the chat box and we'll pick them up from there. Thank you. Over to you, Mari.
Hello and welcome. We have a fantastic panel. I came from the BBC, having managed our anti-misinformation project called Beyond Fake News for the last 2 years, and I volunteered to moderate this because I was actually incredibly interested in hearing what this panel have to say. Media literacy and its role in challenging health misinformation has become a really core part of what the BBC is doing. The coronavirus pandemic has created huge challenges for us. We work in 42 languages across the world. We have audiences that have kind of low sophistication in terms of their understanding of what comes through their feeds on the internet. For many of our audiences, what they see on Facebook, they see as the truth. This is a sole source of information. So for us, this is a really, really important topic. So along with you in the audience, I'm hoping to learn a lot from our incredibly esteemed panelists. So what I'm going to do, I'm going to set everybody off with a minute or so for them to say what their priorities are for challenging what the World Health Organization has called an infodemic. So if I could start with you, Surabhi.
Hi everyone, my name is Surabhi Malik and I'm the program director in India for Internews. Internews is an international non-profit and media development organization, and we work with media organizations, journalists and civil society worldwide to build healthy information environments and tackle the problem of trustworthy information. I'm very glad to be joining this esteemed panel today. I've personally been working on tackling the misinformation problem in India for the last 4 years. I've been training newsrooms and journalists on how to fact check misinformation, how to really verify online content, and now also leading a project on fact checking and media and information literacy. With that, I would like to begin by talking about what I think needs to be the of this session. According to me, we should totally be focusing on how we essentially look at bringing the common public in focus. I know a lot of media and information programs have largely revolved around media literacy curriculums for students and college students and school students. I would really discuss to be taking media and information literacy beyond schools, and I will talk about that after a quick session from other panelists.
And Melissa, can we hear what your view is?
Okay, thank you very much. Yes, and my name is Melissa Sweet. I'm a public health journalist and founding director of Croakey Health Media. We're a non-profit public interest journalism organisation based in Australia. I'm coming to you from southern Lutruwita, Tasmania, and I'd like to begin by paying my respects to the local traditional owners of this country, the Malakadi people, and their elders past and present, and also to acknowledge all Indigenous people who are participating in this event. So I guess when I think about media literacy, I stumble, I must admit, because I've been covering public health for a long time now, and that teaches you to see things in systems and structural ways rather than about teaching individuals or changing individual behaviour. And, you know, I think about what are the intersections between media literacy, digital literacy, health literacy, climate literacy, etc. So I think about the need to take very holistic approaches when thinking about the community's literacy. And public health also teaches you, of course, you know, to look at the power issues. Who benefits, you know, who loses, whose business model benefits or whose interests benefit from the tide of misinformation. And I guess I'd also like to problematise the issue of medical misinformation or health misinformation, and also health literacy in the sense in that I think it can turn us to looking at health in a very narrow biomedical way. And, you know, we know all policies affect our health. And the pandemic has really focused our attention on that in a lot of ways. Richard Horton, writing in The Lancet, wrote about COVID as a syndemic, in fact, that it's not just an issue of an infectious diseases, it's really revealing social inequalities and how social circumstances really shape how the pandemic affects people. So I just urge, you know, consideration in these issues to regard all types of misinformation that can affect our health. And, you know, understandably, everyone is very focused on COVID at present, but, you know, the climate crisis is a huge public health threat looming over us. And, you know, that's another fraught area in terms of misinformation and, you know, the media's role or not in contributing to healthy policy in that area. So they're just some of the things on my mind. And I guess I would say I'm quite active on Twitter, and I have 2 hashtags that I use a lot. One of them is PIJ Matters, which stands for Public Interest Journalism Matters. So really, you know, how can we talk about media literacy if we don't look at the landscape within which we're practicing? And the other one is Regulate Digital Platforms, because I really think that's one of the big public health issues of our times in so many ways.
Thank you very much, Melissa. Masato, your opening call.
Hi. Thank you very much for having me. My name is Masato Kakmoto from the University of Hong Kong. I've been teaching media literacy since 2011, so it's been 9 years since I got into this field. And I also run a daily fact-checking newsroom with the students at the university. When I hear the word media literacy, I feel like some people think of it as sort of like a magic wand. If everybody has media literacy, the problem goes away. And I certainly don't think that is indeed the case. The problems we are facing at the moment in particular, I think there is long-term strategy and short-term strategy. Short-term, I think health experts and journalists need to go through a bit more training in understanding how the misinformation ecosystem work. You know, who is producing what kind of content, why this particular content goes viral, and how the bot works, how the algorithm works. I think that kind of knowledge is necessary for journalists to tackle with this. And some of the media literacy curriculum that I've gone through actually include those trainings. So it's a good idea for journalists to get more familiarized themselves with media literacy training and education. But long term, I think, well, in media literacy, the title of this panel is How to Develop Healthy Skepticism. And I think that's the really difficult part. If you teach people to be skeptical, then they have to be questioning everything, including health authorities and media. So how do you, balance that in teaching? And that's a really big issue. I guess I'll stop here, and then I'm looking forward to our conversation.
Indeed, it's a sort of existential thread that we could grow as big as anything to deal with it. So, Dilrukshi, if you could give us your opening gambit.
Sorry, I lost you, Mary, for a moment.
Sorry, Dilrukshi. Over to you.
So my name is Dilrukshi Handunnetti. I run the Center for Investigative Reporting in Sri Lanka. Of course, we focus a lot on investigative journalism, obviously, and that also calls for accountability in dealing with information. And information is so vital, but information has become a matter of life and death today. And I think journalists have a pioneering role to play in managing disinformation and being able to discern truth from falsehood, and to place it in the public domain with a sense of responsibility. But having said that, that's not the only thing we do. We run separate programs on information forensics as well as digital forensics. They're very different in a way, because information forensics can be taken to people and to audiences that are not trained in journalism, or not professionals, or not lawyers or doctors. So we have different levels of programs. One is now looking at how we can engage children, schooling children, because I think they also need to be joining this conversation. We are living through a pandemic, and they have a role to play, and they are also unwittingly often the victims who do not know, who do not get verified information. It's also important, I think, to highlight the trustworthiness of information. We also know journalists have been often criticized for, being a party to disinformation and propaganda. We are not really, we've been complicit in so many ways, whether we knew it or not. So in a situation like that, what is our new role? What's the responsibility that the society demands? Particularly, I also find that there is greater uh, responsibility that people are demanding from journalists as people who share information. That's because the quality of information has suddenly become so important. We are living through an infodemic, but what kind of information do I need to survive and to live through a pandemic? What's really important to me? I think these questions are coming up, and that's where I would like to leave Mari for the moment.
Brilliant, thank you. Kanchan, your opening minute and a half.
Thank you, Mari. I'm Kanchan. I teach at the Indian Institute of Journalism and New Media, Bangalore. Been doing so for about a decade and a half, but before that I was a journalist for the longest time ever. And so I've been working in media literacy since 2015, when I first met Masato in Myanmar. But before that, we've been taking lectures to colleges all over the country, trying to tell them what your news should contain, but we never called it media literacy because we didn't know what to call it. Having said that, so to focus on what we have to be talking about today, I strongly feel that journalists, more than as much as journalists and the public and school children need media literacy, doctors need literacy as well. One thing we must remember is that doctors, just like priests in most communities, are a trusted lot. And they're really well placed to counter medical misinformation. And they can do this online, but for some reasons they seem to stay away from social media. Maybe they don't want to blur personal and professional boundaries. Maybe they think that there is there's privacy in order, and so on and so forth. But they could do a lot of things in order to counter the misinformation that comes across all over the place. And they must at one level they must be collaborating with journalists, the media, etc., etc. At another level, they need to be speaking to their patients. They need to be speaking to the general public through social media, through whatever means available, in order to counter the misinformation, because they are going to be trusted.
Thank you. And finally, Ying.
My name is Ying Chen from Hong Kong. I've created 2 journalism schools, one in Hong Kong and one in mainland China. And I'm happily retired from daily administration work and back to producing journalism as a founder, as an editor, and as a writer. And I started involved in public health journalism in 2002, when I organized training on HIV/AIDS for civil society groups, NGOs, and journalists in Beijing in those early days. And so this year, I've been very much involved in COVID-19 dissemination information, and working with the medical school at Hong Kong U, which has a long experience, a lot of expertise in research on infectious diseases. And I'm also involved in fundraising and for international organizations, because I think the shortage of resources is a huge issue. Money is not a problem for people who are good, who are passionate, but no money is a problem. So in terms of the crisis, we need to address it at a global level. For media literacy, very briefly, I think we need a whole society approach, which I'm hearing from fellow panelists here. So it's not just the job of a journalist or media professionals or educators. We need a whole society approach. And it also needs to be multi-stakeholders need to be involved. It also needs to be multidisciplinary. I'll just stop here. And a lot needs to be done. We're in a crisis, very much in a crisis. Crisis not only for COVID-19, crisis in mental health, crisis in information and disinformation. A lot needs to be done.
Thank you, Ying. So I thought before we kind of dive into the kind of strategies that might work for, as media educators, as journalists, I thought it'd be useful, Dilrukshi, if you could give us a short overview of where you think all this misinformation is coming, because I think we all understand that this isn't just about health misinformation, that an awful lot of the content we're getting is all very much interconnected and goes way beyond health. If you'd like to give us a minute on that, that would be great.
Thank you, Mary, for the question. I think we can't probably say exactly where it started, but we all heard about the Wuhan theory, that there was this virus manufacturing process in China, and then there was another theory. There have been a million theories, but the second one was probably the big theory was about how the Western interests were also playing into the same thing, and then also about the corporate interests. Never to forget the corporate interests, and that there will be a question of quickly, if you have this kind of pandemic and when there is a real reason for managing a global health crisis, then you are also going to talk about vaccines and preventive care and all of that. So that will also open a huge market. So pharmaceuticals to how to manufacture a proper vaccine, and then the corporate interests that will be coming in, and who will be controlling these corporate interests. Again, the big states, who's going to be the key players. And these are some of the theories that have been really, globally being adding to this information pandemic. But beyond, closer to home, I think there are some others like miracle cures. In Asia, we have we have loads of beliefs and things that we think will work in our favor and will make us boost our immune systems and also prevent the possibility of becoming a COVID victim. So these theories are also there. And one of the things that I found most difficult to deal with, and this is science journalists, health journalists would be a concern. And we've been having long discussions on this. That's about who would be the intermediate force and how. So the zoonosis has also been another thing with various theories being proposed. And so even the scientific community is also quite divided on this one. But I think they are kind of drawing closer to some, conclusive possibilities there. And also our own hopes, belief that we want to believe this. So we have these multiple theories and they're really raging out there. And how do you kind of bring it home, bring it to your workplace, bring it to your community, and dispel, demystify, and think, what kind of information do I need? Do I have to, join a bandwagon? And half the time, disinformation happens because we want to believe in it. We want to believe in something. We also want to feel important that we also understand some of it. And unwittingly, we are also sharing misinformation and sometimes contributing to disinformation. The kind of propaganda at the global level, at the national level, is immense. I mean, I'm from Sri Lanka, Surabhi is from India. We know, just giving two very close examples. We know how our states play into this, what is important, what kind of information needs to be managed. As much as there are conspiracy theories, there are also information management theories that are also state manufactured. And that adds a new dimension to the pandemic and the information management systems that the countries are introducing.
given the complexity of the environment, and it is a complex environment, isn't it? There's a lack of trust in authorities and in the corporate world to deliver, and there's also a vacuum of information. So it's kind of a very toxic atmosphere. What are the kind of things that we can do when we are reaching out to the public who are trying to make sense of this and trying to make decisions about their health and avoiding harm? And I'm going to start with Surabhi, who's been working pretty much on the front line with this in India. I'm going to then come to Masato, and then I'm going to come to Melissa and Ying, and then Kanchan about medicine. So do you get the sense of where we're going to go? So first of all, with you, Surabhi.
Thank you so much, Mary, for giving me this chance. As I was discussing with you in the introduction bit that at Internews in 2018, we sort of launched a program where we first worked with journalists to essentially prepare them to tackle the challenge of, misinformation. And I think, bringing together, just like all, panelists said, bringing together different subsets is very important. So media does play a huge role. So first, definitely, we need to prepare them to handle the science behind if I may say so, the immediate concern is the vaccination. We are all sort of bracing up to end the pandemic together and hoping to tackle what I may call vaccine. I think there's a bit of background noise. If I think one of our panelists, if I can ask others to be on mute. So, like I was saying, as we are hoping to end the pandemic together and bracing up to tackle what I may call and what's commonly called as vaccine hesitation, we need to bring different subsets together and look at the problem. So, prepare the journalists in general first to be more easy on science. Get the complexity behind vaccination, so that can then be transferred to the third subset, which is the end audience. So from scientists and doctors to journalists, and from them to the end audience. I think we need to sort of look at how we join and connect them here, and from there take this forward. With that, I would say definitely I would like to focus on taking media literacy as an intervention beyond schools and colleges. So, once we have, introduced the basics of vaccination, and we're seeing a lot of misinformation on vaccination already, to newsrooms and, prepared journalists, we need to focus on media and information literacy interventions for this big subset, which is the common public, beyond just schools and colleges, which is, your parents, my parents, our families, friends, our neighbors. I really like in Masato's one of the programs, he calls it media literacy for the rest of us. And I really think we must think of the rest of us and how we can tackle the problem of misinformation, for everybody, because this subset in itself happens to be the biggest consumer of online misinformation, and hence in turn online misinformation. And sadly, unlike any other thing that you buy new, you go and buy a new phone, you get a manual along, you go and buy a new car, you get to learn driving first and then hit the road. But that's not been the case with accessing internet. They've all been coming online thanks to the technology innovation. A whole lot of them, millions of them, coming to internet, using internet, but sadly without any guidance at all on how to navigate the online space. So I believe we need to keep them in mind, and this subset has specific needs. In countries like India, and I'm sure in Lanka, a lot of them are mobile only. So how do we think of interventions that can be tailor-made to suit their needs, is what we need to focus on. Media literacy essentially is a life skill. I know I have panelists who would say it should be made mandatory in schools and colleges, but also beyond that, how do we think of this big subset for whom accessing internet happens to be the single biggest entry point for any information need that they have, whether they want to learn about geography or they want to learn about politics, they need to, access the internet. So how about we make that, a basic first for everybody, and at least give them that chance to learn more about their information ecosystem. We often complain about, extra subjects being taught to our, children. Why do they learn something like geography when they don't need to use it ever in their life? But using internet is as basic as anybody across generation has to do that. So we should think of inclusive media and information literacy interventions that look at how we can cater to this entire subset.
Thank you, Surabhi. But Masato, sorry, I think there's feedback coming through, actually.
Yeah, it's kind of hard to hear for me as
Yeah,
well.
yeah.
Sorry, I'm sorry to people listening, but there is definitely feedback coming through. We'll try and sort this out, but I think that's better. Masato, what evidence do we have, though? I mean, I think that, you know, there wouldn't be, who would disagree with giving all the children critical thinking skills in schools so they can understand information? Who could disagree with giving people, you know, media education about, you know, how to understand how social media works? But what is the evidence for actually do we change minds? It feels like we're giving people more and more information, and yet conspiracies are flourishing. You know, things are getting worse, not better. What do we know?
Well, there are lots of research that it's themselves conflict in a way. So, for example, we've done a 7 Asian countries study earlier this year to see if how much internet users in different Asian countries trust traditional news media and how much accurate knowledge about COVID-19 they actually have. What we found was that in none of those countries, there is no statistical correlation between their trust level and their knowledge level. So some people say, I trust the traditional media. I tend to, watch the national TV programs to get information, versus those people who say, oh, I don't trust the media at all. I always rely on my friends on the internet. If you actually test them on COVID-19 knowledge, the score is more or less the same. So in this particular case, again, it's a very preliminary, just one survey, but we did it with Google, and they've done it in 7 countries. And we can kind of see that the trust doesn't always translate into knowledge immediately. Maybe in the long term, it might make a huge difference, but at the moment, we are not sure. So in a way, with the current situation, we have to try something and see if it works or not, with or without the solid evidence we have behind what we are doing, because we wouldn't know until we test it. So I think it's really important to think about something. Of course, you have to be very careful about designing your teaching methodologies and skills and pedagogy, but you have to try and see if it works or not. In my experience, how to sort of tackle misinformation in classrooms is very topic-based. So for example, if you're talking about some of the nonsense rumors treating viruses like bacteria, it grows on its own, it's gonna multiply. If it doesn't work that way. If it's bacteria maybe, but it's not virus. So if you have that piece of scientific knowledge, that kind of information, you will dismiss it immediately. Oh, that's what I learned in P5. No, virus doesn't act that way. That's bacteria. So if many people have that kind of knowledge, probably that kind of misinformation doesn't go away. Will go away very quickly. So in this particular case, we do think just teaching basic science helps. But on the other hand, wearing mask is another good example. It has been politicized. It's no longer about science. Wearing a mask or not is a political statement in some countries, not in Hong Kong, but in some countries. So if you are under that environment, it doesn't really matter if they have scientifically accurate information or not, because wearing mask or not is a political statement. And the logic behind it, science behind it, is completely secondary for many people. When you're facing that kind of situation, probably critical thinking really helps a lot, especially self-reflective part of critical thinking. You have to question your own bias. You have to question your own political inclination. And if you could teach people how to sort of reflect that and see, okay, I don't want to wear a mask. Is it because of the science or is it because of the politics? So that probably gave them a pause before they take to the street, right? So I think it really depends on what topic and what political situation you are in. Your strategy can be different, if that makes any sense.
No, absolutely. So we've got some questions coming in. Kanchan, one of the questions we've had is, what difference will it make if it's the voices of doctors who are delivering some of the messages? Would that help? Kanchan, you're on mute.
I'm sorry. So just like Masato said, that this whole business of scientific literacy to find the difference between a virus and a bacteria might not be possible for everyone, but it is the doctors who are in constant touch with people, with the common man, so to say, who will be able to make that difference, to who will be able to tell them, look, this is not how it works, but this is how the reality is. This is what the science behind it is. And the doctors will be trusted. And that is why it is important that we have doctors out there on social media, out there in all forums, talking about what is really happening and debunking the myths that are there around the whole pandemic. It's really important that doctors come out and talk about it. And because basically they are trusted, people know that they can be, people go to a doctor and they trust a doctor and take those medicines. So it really is important that doctors can do it in various ways. If they don't want to engage in social media, there are other things like Reddit has something called Ask Me Anything. So there are ways that they can get in touch with them, and that is one part of it. The other part is the way doctors and the scientists interact with journalists. There seems to be this wall between doctors and scientists on the one hand and journalists on the other hand, because the scientists and doctors are afraid, and maybe rightly so in a lot of ways, that journalists will tend to misinterpret what they're saying in their effort to simplify it. And they need to bring journalists and doctors and scientists need to come together to ensure that what is being put out is accurate while it is understandable by everybody. And that is why it's really important that doctors come into this conversation.
Ying, I get kind of connected to that, and again, it's a question that's come in. Don't we have a whole problem of scale here? That the size of the problem is huge. The amount of people with these kind of skills to change, go out there and change hearts and minds. If we're relying on journalists, educators, or even doctors, is there any way of kind of changing things like this? Especially when you think there's an awful lot of vested interests of not bringing critical thinking skills into the classroom, isn't there? I mean, there's a lot of states where things are going in the opposite direction. People don't want their populations to think critically. Sorry, Ying, you are also on mute.
Oops, sorry. That's why I think we need a whole society approach, that every sector of society need to be engaged in promoting understanding, in dispelling misinformation, disinformation. Like one sector that's often missing is people at the top, whether it be corporate chiefs, whether it be politicians. A recent study showed that a lot of misinformation are actually top down. Politicians, celebrities, and other prominent people, they generated 20% of the misinformation. Okay, 20% doesn't seem much, but then they accounted for 69% of the engagement in social media because they are KOL, they're influential, right? So somehow we need to engage these people. We need to talk back to these politicians. We need to, so it's not just talking about educating down. You need to educate up, right? And of course, how to do it is situational, depends on context, depends on the political system. But I think that's very important. And I also want to add to the point about doctors and journalists. And so it's very important to have doctors who are engaged. And so they not only work in the research labs or in the hospital, they also talk directly to the public. I think in Hong Kong, we're fortunate to have such doctors, very public-minded. They very willing to talk to the media. When there's some crisis and was outbreak in some housing estates, the doctor would go there to go on site and talk to the media at midnight, to have a press conference right on site to tell people, well, it's not transmitting through the pipes. Don't worry, you don't have to evacuate, go home and sleep, okay? So I think that's very important. So it's not just journals. There's only so much we can do, and we need to stop talking too much to each other. And we need to talk to the big wide world, to different sectors, and get them engaged while we try to learn the language of science and of the epidemic.
Melissa, I wanted to bring this to the role of the platforms and the role of regulation. And we've just had a question, well, a comment really. Conspiracy theories sell when truth is sometimes boring and doesn't pander to the base. What is the, how do we, you know, the platforms are where most of this is going on. You know, do we need to think about our relationship with the platforms, and what do we do at that level?
Absolutely. As we've been talking, I've been picturing a metaphor that's often used in public health, for example, in obesity. You know, they talk about people being in a river flowing downstream, like it's pushing people in the direction of eating bad food, not exercising, and that's because of, you know, the food industry or the way we design our cities. And so we're telling people in this river that's pushing them down over the waterfalls, you know, just swim harder. And I'm just thinking about listening to this conversation. If only we can make people, you know, understand health or science, you know, that'll fix things. And no, I actually think we need to pull them out of the river. We need to make the environment safe for people. And I think that's a very public health sort of foundational approach. You know, if the environment's not safe for people, then how do we make it safe? And it's rarely just by changing individual behaviour or knowledge or understanding. So, you know, taking that metaphor to look at the platforms, absolutely we need regulation. And, you know, there's reports all around the world building momentum in this area. I mean, I don't know how to lay out a map to do it, but I think this is absolutely vital. And, you know, it's just not fair on people to expect them to be able to decipher and understand the tide of misinformation that's coming at them, you know, drowning them literally. You know, we need to regulate these platforms to make them a safe space for people. And you know, you can look in the States, it's just absolutely incredible what's happened there with the pandemic. And, you know, it's doctors aren't trusted, you know, there's calls to behead the heads of public health, you know, and that's spread on the platform. So, you know, I really think unless we make the environment safe for people, and then, you know, health literacy, media literacy, all of that sort of stuff, of course, matters. But if the environment's not safe, you really, people are being pushed over the rapids. That's my sort of metaphor, I suppose.
Now, as predicted, time is. Are people hearing this feedback? Or is it just me? Sorry, people. I'll just pause while. Great, thank you. We are down to our last 8 minutes, and that gives everyone a chance for one short bite. And I'm just going to kind of talk about some of the questions that are coming through, which I think there's a desire to hear a bit about the kind of methodology that can be used at ground level in terms of language. And there's also a kind of hunger to understand a bit more about how we would resource and do these sort of things at scale. So if I could go back, first of all, to Surabhi about how do we actually reach out to people in language they understand, and that would be effective.
Yeah, thanks, Mary. I think, you know, the right question on scale, and I can totally, you know, take it up as you're aware, and I'm glad that we had a chance to work with some of the panelists on this program that we're working on in India, which is called Pakshala, where we essentially hope to train the people at large, you know, people from rural areas and non-metro cities in the country, learn more about how they should typically analyze the content better, and you know, to cater to a country as diverse and vast as India, with, you know, the population speaking the very many languages that we are so proud of. We followed a very unique model, you know, and roped in a cohort of experts, you know, handpicked from so many states and cities. You know, we brought together media educators, journalists, and also non-profit workers together. So we could, through their help, you know, go back to their communities to funnel, you know, the sense of media and information literacy and critical thinking, which is really required at this time, you know, like I said, to tackle, the infodemic that all of us have been subjected to through the last year. You know, before we really started that off, we thought, why don't we really try and understand, you know, the sea of change in media consumption patterns. You know, people are now spending hours on their, you know, feeds on platforms which really do not differentiate between a journalist putting out something, or a news organization putting out something, or just about anybody without any label. To a layman, it all looks same. So we tried to understand, do they really understand this change? This wasn't the same case about 3 to 4, years ago, or several more years ago. And we did this, quick study wherein we figured out that, the results were startling, and we really understood that people, catch the wrong signals, the really signals that they catch, and they completely ignore the source, which brought us back to, this conclusion that we must help them understand better their online information system, ecosystem. And that's where we took it off from. So they know what they're accessing online, what are the various, forms of information that they access, how trustworthy each one of them is, and really what are the strategies they should apply to reach a trustworthy source of information in their particular country. So I think, that approach sort of has worked for us for a fact-checking program. We trained journalists, and through them, generated a lot of fact-checking content so the common audience could know. I think the health misinfodemic really calls for more for it, because science is complex. It's not as sensational as misinformation, and collectively we hope we will be able to make a dent again.
1 minute each for these last thoughts. Masato, what would be the metric, a question that's come in, what's the metric of success for a media literacy program? How do we know if it's worked or not?
Well, that really depends on what you want to achieve in the first place, right? So it really depends on your goal. You decide how to measure the success. So it's really hard to answer that question to me, to be honest. Just one bite for like each of the points. Scale. I believe if you want to really scale this up, I think media literacy training has to be part of teacher certification program. Every teacher in every country who's teaching in public school, they have to go through some sort of media literacy training before they become a teacher. I think that will scale up quickly. It's a long-term solution. About the environment, I think there's a difference between not knowing what is junk food versus eating junk food knowing it's unhealthy. So I think when it comes to misinformation, we are not even at the stage where people don't know what is junk food and what is healthy food. So I think we have to go there first before we talk about the next step. So awareness campaign might still help at this stage, even though the problem is really severe. So I think pushing more, making people aware of this problem might be some of the things that we should be doing as well, because there is this trend that, seems to be people saying that, well, everybody knows about fake news, we got to do something else. I agree, but it might still have some role. Lastly, regulation. I think internet advertising should be regulated more than anything else. It's not the content, it's how the money is being made by going viral. And I think that's fundamentally driving this phenomenon, in my view.
Thank you. Dilrukshi, your last thought to all the doctors, health workers and journalists who are listening to you. And you're on mute. Great.
Yeah. Thanks. Just a quick bite. I think journalists need to start working with those who actually have the information and the knowledge. So you need a relationship with those who know the science. You need to pioneer conveying information to the public, because that's your job. And I also do. I've become a huge convert of believing that you have to have sustainable fact checks. And I think, speak of the journalists now, you need sustainable fact-checking initiatives, because we do these very sporadic, small time interventions. They are critically important. But I think if you're going to live through a pandemic successfully, you need to see you need a multi-layered approach, and you need things that continue, months on end, so that people will have better access to understanding what it is.
Thank you. Melissa, your final thought.
Well, I guess just going back to the point about education and awareness, of course, that's important. But when we look at the history of just about every public health issue, for example, tobacco control, when smoking rates really started to go down was not, when we had doctors telling people stop smoking. It was when we introduced reforms such as taxing tobacco, making it more expensive, regulating advertising of tobacco, regulating industry, essentially. So I just make that point. You know, it's not either or, but if you're not doing regulation and tackling it at a structural and system issue, then you can do all the individual community education in the world, and I think you're pushing it. You'll still be going over the rapids.
Thank you. Kanchan, your final thought to our doctors, journalists and public health workers.
Yeah, so basically we need to foster a culture of fact-checking within the general public as well as within doctors and public health workers, etc., etc. The minute something is out, somebody needs to counter it because, as somebody said in the audience, the lies travel much faster than truth does. So we really need to be proactive and counter the misinformation before it actually becomes, it goes viral.
And final thought, Ying, you get the final say.
I would like to see more collaboration and partnership across disciplines, across countries and borders, because the problem is so huge and we can't do it alone, right? We face common challenges, but also challenges that particular to our culture and to our situation. So first, and then I would like to also see Asia to be more engaged in the global efforts that are emerging, where it be raising money to create a public fund for good media, whether it be developing a digital infrastructure, a protocol to regulate and deregulate the platforms. Those are huge issues. And we need to be more engaged in these global efforts. And then that will help give us more a bigger vision and to identify our problems. And we just have to work together a lot more.
That's been fantastic. I can't tell you how interesting that has been. I'm so happy that we all came together to have this discussion. We've put lots of thoughts out there. Obviously, it's a huge problem. This is just almost like at the foothills. But thank you all very, very much for participating. As predicted, we probably needed double the amount of time to really dig deep. But I think at least we can hope that people will have left this with food for thought and they can go back to their teams, their places of work, and just start to think about where they can make a difference, whether it's lobbying for change or whether it's as practitioners and thinking about how they can be most effective and have the most impact with the people they're working with. So thank you very, very much indeed. I've learned a lot.
Bye-bye. Thank you.
Thank you, everyone.
Bye-bye.
Thank you, Mary. Thank you.